ladies and gentlemen, and my seniors, juniors, and colleagues. I'm very pleased that CIPLA has organized such a informative audio program so that many patients will be benefited immensely, and not only in India, but whoever listen to it will be benefited by it. So it is a good endeavor. Now, I am Dr. Saroj Kumar Kothari. I practice at Calcutta. My chambers are in Beleghata near Fulbagan, and also in Ganesh Talkie, Apollo Clinic. So our today's topic is hypertension, impact of hypertension in our body, and control of hypertension. So first of all, I will explain what is hypertension. Hypertension is nothing but high blood pressure. All know about blood pressure. Whenever we go to a clinic, doctor measure it. And so we must know how blood pressure affects our body and what is the normal blood pressure. So in most of the countries and organizations who are dealing with hypertension, they say that blood pressure of 120 by 80 is normal. So there may be some variation. It may be slightly low or slightly high, but this is the ideal blood pressure. Now, why there is blood pressure? Blood pressure is due to two factors. Now, we know our heart beats, and without our control, it beats. So whenever heart beats, it generates pressure, and it is beating continuously. And also, it when it beats, blood flows out and circulate throughout our body, and it passes through arterial vessels, and so they also exert some pressure, and that pressure is called diastolic pressure, and the heart pumps, that is called systolic pressure. So there are two values in measurement of pressure. Number one is systolic pressure, and number two is diastolic pressure. So the ideal blood pressure, systolic 120 and diastolic 80. Now, the thing is, it is very easy to measure, and if we can use just one instrument and measure blood pressure and control it, then we can avoid many other diseases, because blood pressure affects most of the organs of our body, because blood circulation is everywhere. Now, one may ask, what are the causes of hypertension? So we cannot tell definitely what are the causes, but there are some factors which may affect. These are age. With age, increasing age, pressure will increase. Number two, our habit. If we consume too much of salt, pressure may increase. If we consume junk foods containing too much of oil, excess salt, these may cause hypertension. Also, there it is linked to family history. If 2, 3, or even one person in the family is affected with hypertension, the chance of developing high blood pressure is very high. Now, another factor which is very common in nowadays is stress. We take too much of stress and we do less physical exercise. So these two in combination may precipitate hypertension. Now, moving on, why hypertension is so important and why we should detect it as early as possible. Now, hypertension is called a silent killer. Why it is called a silent killer? Because most of the patients do not develop any symptom of hypertension for many years and months and years. So there is internally damage to other organs like kidney, eyes, and heart. So if we can detect hypertension early by measuring blood pressure, we can prevent the organ damage. But sometimes patient may come with some symptoms like neck pain, dizziness, unexplained weakness. So in that case also, regular measurement of pressure, both office blood pressure, that is we call in clinic, and also their home blood pressure is very important. Now, the blood pressure level, if it is more than 140/90, we'll call it hypertension. So how could we control hypertension other than medications? We have so many medicines. We can control hypertension by giving medicine, but at the outset, I must say that lifestyle modification is very much important. We'll ask the patient to do moderate exercise and quit smoking and quit taking alcohol. And there must be some stress management ways. They must do exercise. They take less salt and less junk food, which contains fatty acids, and those fatty acids are saturated, and also salt. So regular exercise or physical activity improves heart rate. So heart has to give least effort to pump out the blood. And also, if the body is healthy, muscle is healthy, then the vascular resistance, that is the diastolic pressure, is also becomes slow. So by doing regular exercise, it will help. Now, for diet, we advocate diet which is low in salt, high in nuts and fibers, green vegetables, salads, and low in saturated fat. One such diet is called DASH diet, DASH diet. Other diets are also there, but the principle of diet is same. Take less saturated or nil saturated oil, less oil, and no added sugar or junk food. Now, most of us do not know. We do not know that how much salt is there in one small teaspoonful. It is all in a small teaspoon, but it contains 2,300 milligram. Whereas a normal person should not take more than 5 milligram of salt per day. But we are taking too much of 5 gram of salt. But we are taking too much of salt. So we should control intake of salt, and we should regularly monitor blood pressure so that we can share it with our physician or health provider so that we can control with medications and other means. Stress management is also very important. A good sleep is also important. And another thing is adherence to medicine. There are so many medicines. Most of the hypertensive patients, they could be controlled by giving medicines, either one drug or two drugs or three drugs, but we should maintain blood pressure below 130/80. That is our goal. Now, there are also some cases of resistant hypertension, but these are very less. Out of 100, only 4 to 5% have resistant hypertension. For that also, we have so many medicines, so we can control it. But regular measurement of blood pressure is very much important for this. Now, one may raise question, why should you control blood pressure? Because if blood pressure remains high, it may affect our eye, leading to blindness. There might be retinopathy, and that will cause blindness. There might be renal failure, that is kidney is affected, and it is chronically affected. Ultimately, it will the patient will land into acute renal failure or severe renal failure, for which he may need dialysis or kidney transplant, or there may be heart attack due to lipid deposition due to high blood pressure in the vessels. So there may be heart failure due to high blood pressure. Heart has to pump a lot. So these are the very severe complications, and these complications can be measured only by a small instrument that is called sphygmomanometer. Now electronic BP measuring devices are available. One can easily purchase and measure their blood pressure. For that, we observe May 17, the World Hypertension Day. It has got so immense significance that we observed a day for it. A simple disease measured by a simple instrument is being observed by whole world as a hypertensive day. So I wish all my patients, all the audience, they should frequently measure their blood pressure either himself or by taking somebody's help, and discuss with their healthcare provider to how to control this blood pressure and live a good, healthy life. Thank you very much.